types of allergies.
In this video, we'll discuss several types of allergies: food allergies, anaphylaxis, allergies to insect stings, pollen food allergy syndrome, drug allergies, hives, angioedema, and contact dermatitis.
Let's start with food allergies. Food allergies are more common in children and are usually caused by certain proteins such as nuts, soy, dairy, seafood, and wheat. Worldwide, over 200 million people suffer from food allergies. Most children can outgrow their allergies to cow's milk, eggs, soy, and wheat. Nut or seafood allergies, however, usually do not go away with time. Symptoms develop within a few minutes to a couple hours after eating the food. While some people may only experience mild discomfort, others may experience frightening or even life-threatening symptoms. Common symptoms include tingling or itching of the mouth, hives, itching or eczema, swelling of the lips, face, tongue, or throat, abdominal pain, diarrhea, nausea, or vomiting, wheezing, nasal congestion, or trouble breathing. For some people, a food allergy can have grave consequences. Anaphylaxis is a dangerous, potentially fatal allergic reaction that can cause a person to go into shock, and for some people it is triggered by a food allergy. If not treated, anaphylactic shock can lead to coma or death. Know the symptoms of anaphylactic shock so that you can recognize them quickly and act fast before it is too late. Symptoms include a swollen throat or feeling a lump in the throat that makes breathing difficult, constricted airways, nausea, vomiting, or diarrhea, shock accompanied by a severe drop in blood pressure, a weak and rapid pulse, dizziness, lightheadedness, or loss of consciousness. If you know you're at risk for anaphylaxis, carry an epinephrine injector with you at all times. If you experience the symptoms of anaphylaxis, call 911 right away.
Let's talk a little about allergies to insect stings. For most people, insect stings cause pain, swelling, and redness, but for some people they can result in anaphylaxis. As we just discussed, it is important to know the symptoms of anaphylaxis so you can recognize them quickly and get treatment right away. Carry an epinephrine injector with you at all times if you know you are at risk. Insects that commonly cause allergic reactions include bees, wasps, yellow jackets, hornets, and fire ants. If you are stung by a bee, remove the stinger and the attached venom sac as quickly as possible. Don't squeeze the stinger. This will squeeze more venom into your skin. Instead, scrape it off. Disinfect with soap, water, and antibacterial ointment, and if needed, use ice to reduce the swelling and apply an itch relief ointment like hydrocortisone cream or calamine lotion. If you are stung on the hand, remove any rings or jewelry immediately. To prevent getting stung by one of these insects, wear long-sleeve shirts and pants when outdoors, and wear shoes and socks. Don't wear loose-fitting clothes that can trap insects, and avoid wearing bright colors because they can attract insects. Be calm and quiet when around stinging insects instead of waving and swatting your arms, which can aggravate them. Cover your food and drinks when eating outdoors, and check before you drink from an open can or container. Don't disturb insect nests.
Let's move on to pollen food allergy syndrome. Some people who have hay fever are also allergic to fresh fruits and vegetables and certain nuts and spices. This is because the proteins in certain foods are similar to allergens found in certain pollens. For example, if you're allergic to birch pollen, you may also have a reaction to apples, carrots, celery, hazelnuts, peaches, pears, and raw potatoes. If you're allergic to ragweed pollen, you may also have a reaction to bananas, tomatoes, and melons such as cantaloupe, honeydew, and watermelon. If you're allergic to mugwort pollen, you may also have a reaction to apples, carrots, celery, kiwi fruit, peanuts, and some spices, including caraway seeds, parsley, coriander, anise seeds, and fennel seeds. Proteins are denatured or destroyed by heat, so if you cook the food, it will no longer cause an allergic reaction. But how do you pinpoint a food allergy? Be observant. You or your allergist may use an elimination diet. In this method, you eliminate a certain food from your diet for a period of time and observe whether your symptoms are relieved. Certain drugs or medications can also cause an allergic reaction. Make sure you read the fact sheets for the medications you are taking. If you experience any allergic or adverse reactions, make a note and tell your doctor. Let's cover 3 additional kinds of allergic reactions. Hives, also known as urticaria, is a swelling of the skin that appears as itchy raised spots that may be pale in the center. Angioedema is similar to hives, but the swelling occurs beneath the skin, like swelling of the lips, tongue, throat, or eyes. In severe cases, angioedema can block the airways, block breathing, and become life-threatening. Hives and angioedema can be caused by allergic reactions to medications or drugs, foods, or insect stings. Contact dermatitis is another type of allergic reaction that results in skin rashes. It occurs after contacting substances such as poison ivy, nickel, or topical creams. Contact dermatitis is a delayed hypersensitivity reaction, which means that it may not occur until 2 to 3 days after exposure to the substance. Phew, we've covered a lot. Now you are much more knowledgeable about the many different types of allergies that are out there.